Hi, Dave. Hi, Aaron. Welcome to our new office. How's it going?
Hi.
Good to see you.
I love the new lobby.
Thank you.
I can only imagine what's behind that door.
Yep. So we've got the lobby here, and let me take you around the rest of the office.
All right.
So right here, you've got the reception area.
Right. I want to see the good stuff.
Okay, let's go to the good stuff.
The doctor part of the area.
All right.
I'm a little nervous, I gotta be honest with you, with this whole like sperm test and everything like that. I don't know why I create these crazy protocols and then I have to endure them.
Well, here's one of our new patient rooms.
I like it. Very professional looking, I might add.
Thank you.
It almost looks like a doctor's office. Did you get your body fat tested yet, Aaron? You see?
No, I haven't done it yet.
Yeah, you should get on there.
Yeah.
Those things are very inaccurate, though. I think for guys like us that are very muscular. I like the candles. It's very, very good ambiance here. I feel relaxed.
And here's one of our other offices.
So you have 2 rooms.
We have 2 rooms that we're using right now.
Where's the sperm collection room?
The sperm collection room will be the bathroom.
Do you have any porno in there or anything like that? Oh, the bathroom. It's very, very unglamorous. I don't know if I could do it in here. I need materials, you know.
All right. Per your suggestion, we'll put up some posters.
We'll put up some posters?
Yeah.
Thank you. Now, how long have you guys been in this office?
We have been in here a couple months.
Oh, good. So, I mean, I know a lot of RX muscle people have been telling me they've been coming down to do and doing the protocols and everything like that. Have you been seeing a lot of patients?
Oh, yes, absolutely. And we have a new doctor. Have you met Dr. Wiley?
I did meet him very briefly. I like him.
Okay, fabulous.
We're going to talk to him in a little bit. We're going to go over the protocol that kind of I designed, but that he endorsed, obviously.
Yeah.
And because there's a lot of guys out there that can't get their girls pregnant. Let's face it, bodybuilders have problems with that. Sperm counts are low, and I think this is going to help a lot of people.
Yeah, we've already talked to a bunch of people about it, and they say that they've tried their primary care, they've tried their urologist, and nobody seems to want to help them just because the reason that their sperm production is shut down is because of steroid use.
Yeah, I went to my urologist once, and he was like, you know, we could do a sperm test on you. I said, well, you going to prescribe anything for me? He's like, well, we really can't. You know, the protocol, I mean, the procedure to get the stuff that I knew I needed would have been so complicated. I would have gone to 14 office visits. You know, it's a pretty easy solution, but I think a lot of doctors are not comfortable because they don't really know that much about it.
And we've put in a lot of work. We've tried to get the best pricing. We've talked to a lot of distributors. So there's been some work on our end to make sure that we have everything in place for your protocol.
And I know that some of the compounds that I had selected were not the easiest to get.
No,
So, but you got them.
We did. We got them.
All right, let's go talk to the doctor and find out a little bit more about what we're going to do, and then I'm going to do the procedure. I don't know how I'm going to do it, but I'm going to try to do it. I'm not happy about the whole idea that I have to give a sperm sample, and that's a urine collection.
Your little soldier thing going here.
I don't know if I can fill that thing up.
They said you need at least this much.
No, I can't fill that thing up.
Well, you're gonna have to wait. You're gonna have to do it over and over.
But you know what? I'm kind of interested to see if I do have any sperm production, because I've never gotten a woman pregnant. Not that I've been trying to, but it's never happened.
You might have a few, just like 3 or 4.
You got Darielle pregnant. You never know.
All you need is one, right?
That's right. That's right.
Obviously, you want more than one, though.
Well, let's see what Dr. Wiley has to say about it, because there he is, sir.
Hello, how you doing? I'm Dr. Wiley.
Hey, Dr. Wiley.
How are things doing for you?
Very good, very good. We were just talking. I'm a little nervous about the whole procedure, but I did design the protocol, so okay. I think that
the protocol is actually pretty good. We've taken it to a couple of different urologists and fertility experts, and they all say it's an aggressive treatment, but it's a good treatment.
I'm into aggression. You know that, Aaron.
You want
very aggressive.
Yeah.
So, if you want results, this will give it to you.
Right. I look at it this way, and hopefully, you're the physician, but people want results fast. I mean, it's terrible when you have to wait a year, for something to work.
That's the society that we live in nowadays.
Instant gratification.
Exactly. There you go. But this will definitely get you there.
Now, there's 2 protocols I designed, because one was a little more expensive than the other. I understand. The Pergonal or HMG.
Right. Is pretty expensive.
It's very expensive stuff, but that's really, from what my research that I've done and my experience over the years, that's
the one that works.
That really works the best, right?
Exactly. Exactly.
And that'll increase sperm production pretty, quickly.
Yes, exactly. What it does is it works in the pituitary. It helps, basically get your sperm going.
Yeah.
It causes spermatogenesis.
I want a big growth. I want a lot of sperm production right away, Aaron.
If you're trying to get somebody pregnant, that's always the best way to go about it.
It's funny because, and this is off topic, of course, no pun intended, but they say a lot of porn stars use Pergonal. or have used it. It increases a bigger volume of semen.
It's very expensive. It's worth that to them.
I guess, I don't know. I guess,
That's your job.
That's right. That's right. All right. So I'm gonna give the sperm sample to you guys. You're gonna test to see if my sperm are low, which I assume they probably are. Okay. And then I'm gonna, I guess, partake or embark on the sperm raising protocol.
There you go.
And you guys are going to write all the prescriptions for me, and I'm going to have it all sent to me.
Exactly. We take care of
Absolutely.
all that here.
Now, for the lay person, because I know a lot of people out there are watching this video, and they're going to say to themselves, how do I go about doing it? Is this something that you guys will send people to a lab to give the sperm, and then you guys will write the prescriptions? How does that work?
Usually that's what we do. You do the sperm test at your lab. We'll get the results here. And then from there, we can kind of
prescribe what you need.
Yeah, exactly. We can prescribe what you need and kind of tailor make it to you. Basically, like you said, there's 2 different protocols. So depending on
the more expensive one, the less expensive one. Exactly. Now, from what I understand, also is that if the person wanting to do this is a patient of Envizion already, and they've seen you or one of the other physicians here, then they won't have to come down here again and do that.
As far as I know, yes.
Yeah, that's from what I understand. For people who haven't seen the physician, they'll have to come down here.
Right. Yeah.
But the good thing is, if they come down here for this, and then after they get their wife pregnant or whoever they want to get pregnant, they could obviously then embark on a hormone replacement as well, without having to come back and see it.
Here's a question: What about if you're on hormone replacement therapy here? Can you do the day of protocol while you're still being on the testosterone replacement, or is that?
Well, he's the expert, but I don't think it would work as well.
Exactly.
You have to take time.
Exactly. You want to come off of the testosterone, because basically the testosterone in and of itself can
suppressing the body.
Exactly.
Good. That's
keep you from making the sperm that you want to make.
Sure. See, now I know Dr. Wiley said what I wrote was aggressive, but the reason I did that is because there's different reasons why our body won't produce sperm. Number one, there's no stimulus to produce the sperm.
Right.
The HMG will do that. We'll create the stimulus. We'll tell the body to start producing sperm. HCG will do that too, and we have those both in the protocol. HMG does it a little more potently. Then, we have a Arimidex in there, which will block the conversion of testosterone to estrogen, because estrogen is what shuts the pituitary down from producing the signal to tell the testicles to produce testosterone. And then I have Clomid and Nolvadex in there as well, which will block the receptors in the hypothalamus and the pituitary to make sure that the testicles keep producing testosterone. So I got every angle covered, Exactly. So if this doesn't work on me, I'm done. I'm sterile, basically, is what I'm saying.
You're adopting.
Yeah, I'm adopting. I'm going to adopt a dog or something like that. But, all right, so the protocols, I fill that up. Now, I understand when you give a sperm sample, it's very important that it gets immediately to the lab, because it goes bad.
I think it's within at least 30 minutes that they want to make sure that you get it, because they want to keep it on ice, and any longer than that, you start degrading.
You want to ice my sperm, Aaron?
No. I don't want anything to do with it. I want to stay as far away from your sperm.
The reason I ask is that's why it's better to go to a clinic locally to you and just give the sample there.
Exactly.
Now, you guys don't really have I'm used to seeing in that movie Road Trip, where they go give the sperm, and there's like a nice room, and there's like a couch, and there's like movies.
I don't think they have that even.
No, all I got is a bathroom here.
We don't have the videos and the movies.
Everybody has an iPhone now, Dave. Just use your iPhone.
That's right. Jimmy Pilecki that's his methodology. This instant porn all on there.
There you go.
All right, I guess let me embark on this, and then you guys will let me know what does it take, about a week to get the results back?
Yeah, I usually say about a week. It might take a little bit less than that, but a week will at least give us the time to make sure that we get the results.
I could be high. If I'm high, I don't have to do this, but if I'm low, the meds will be sent to me in the mail. Is that how it works? Just like the regular hormone replacement goes?
Exactly, just how we do the hormone replacement.
Dr. Wiley, thanks a lot, man.
Pleasure.
You made it easy.
You're very welcome.
All right, Aaron. Only for RX Muscle do I do this type of stuff here. I got my little collection vial. I don't know what I got to do with this. I guess it's got to
moist towelette.
I got to clean off a little bit, but it's not really. It doesn't have to be sterile. But who the hell knows? All right, I'm going to go in there. I got a little. You gave me a good website for porn on my phone, so that should help out a lot. And I guess here goes nothing, right?
Here goes.
All right. I hope. It takes me a long time to do this, so I hope you guys are patient. Successful.
Don't touch
it. I'm putting it right into the ice. All right, and this is going right to the lab, right?
Correct.
Only for RX Muscle, Aaron. I can't believe this kind of stuff doesn't happen very often. I don't like to be that revealed. I don't like to be that exposed. That's what I should say. It's very exposing. Would you do this if I would have asked you? If you weren't, pregnant with Daryl?
Probably. You know me.
Yeah, you probably would have done it.
I'm not like you. I'll do whatever. Yeah.
All right, well, let's see. We're going to find out how potent I am, and then if I'm not as potent as I think or suspect, we're going to start the protocol, and we'll let you guys know how it all works out. My Envizion medical package is here. There's some good stuff in here. This is some potent baby making stuff in here. And let's go upstairs and we'll take a look and see what's in here. And I think there's a lot of good goodies in here. All right, let's open up this. And as you guys know, this is the pregnancy protocol that I designed, and all the drugs supposed to be in here. I hate to admit it, but my sperm tests came back low. Very low. So this is going to be the test to see if my sperm count can go up using these, then we know the protocol works. And I'm pretty confident in my my abilities. Let's see what they put in here, because I heard they threw a few extra goodies in here. What the hell is this? Let's see. Cyanocobalamin. Do you guys know what that is? For those of you out there who might know, that's vitamin B12. That is the chemical name. And I guess they want me to take a couple shots of this too. I don't know how that's going to help sperm count, but it can't hurt. I guess increases protein synthesis. Here's the protocol on how to take the stuff, and we'll go over that after. Ooh, look, they have stuff packed like it looks like a little Christmas gift right from the pharmacy. Let's see what's in here. We got clomiphene citrate, and then we're going to take 50 milligrams of that twice a day. Okay, that's going to block estrogen receptors in the hypothalamus, which is going to in turn increase LH and FSH production from the pituitary gland, which will stimulate my testicles to produce testosterone and sperm. That's what we want. Very good drug. This is given to women too, to increase ovulation, but not going to do that in men. Now we also have Nolvadex, which kind of does very similar effect to the Clomid, but it hits things from a slightly different angle. It blocks estrogen receptors as well, and will increase pituitary output of the FSH and LH, which is necessary if you want to increase sperm production. So we're hitting double whammy, so to speak, double whammy. And then we have some anastrozole here as well. And the anastrozole, obviously, is also known as Arimidex, is an aromatase inhibitor. So it'll block the conversion of testosterone into estrogen. So not only will we block the estrogen receptors, we will block the production of estrogen, which is also will shut down our bodies. Okay, that's good. Let's see what else we got in here. All right. All right, now this is the key stuff. This is called Pergonal, human menopausal gonadotropin. This stuff is like $1,500 for this bottle. I mean, this is if you do there's two protocols. There's the day Palumbo protocol, and then there's the super day Palumbo protocol. The Pergonal will almost like, in essence, supercharge your sperm production right off the bat, and it acts like the hormone FSH, okay, which in women would stimulate ovulation and production of eggs. In men, this will crank sperm production tremendously. So it's like you give yourself a little kickstart in the beginning. You do the HMG Pergonal shot, then you go right on to the Nolvadex, Clomid, and Arimidex. You keep on that. I'll do a little B12, and then I'm going to start taking my HCG shots, which is also in here, human chorionic gonadotropin, which will also act like Pergonal, but not quite as strong in the FSH. It's more of an LH stimulator. But what we have to remember is if you produce sperm in the testicles, that in turn increases, if you produce testosterone in the testicles, that in turn will increase sperm production in the testicles. So we're hitting everything. We're taking care of the pituitary, we're taking care of the testicles, we're taking care of the signaling, we're reducing estrogen in the body, and hopefully within anywhere from 2 to 3 months, I will see a dramatic increase in sperm production. Now, what I will do with that sperm production remains to be seen, okay? Because I don't really have anything to do with it right now, but it'll be interesting to see if it works, because I'm sure there's a lot of you out there who have problems inseminating your girlfriends or hopefully wives, in that matter. And Aaron Singerman seems to have super sperm because he got his wife pregnant and it was no problem, but he's a little younger. But anyone out there who is looking to have kids, this is important, especially if you've done anabolic steroids for several years, or some people have used it as long as 15, 20 years. You might have suppressed your production in the testicles and thus suppressed your sperm production, in which case you need to boost it up. Now, evidently that's something that I have done, and I've been on replacement for a long time, so that would keep my sperm production low. Let's see if we can raise it up. Thank you to Envizion Medical. Great new pregnancy protocol. Catch them at envizionmedical.com.
Luck be a lady tonight. Luck be a lady tonight.